Well, good afternoon, everybody. My name is Lee Schwartz, and I'd like to welcome you to the first webinar in our 2024 dental series. This one is titled Key Insights for Hiring an Associate in Your Practice. We're excited to bring another year of interesting topics, and we encourage you to sign up for the other webinars in the series. I will have more info on those at the end. But before we get started, I want to just take a minute and say a couple of words about SVA and our history in the dental industry. Like many of you, we got to where we are by being independent, and our vision moving forward is to remain that way and continue serving the same clients we have since 1974. And a big part of that client base over these last now 50 years has been dental practices. Our mindset is that when you're a practice owner or shareholder, you have to work with someone who's more than just a tax preparer or accountant. You need someone who's a true advisor working collaboratively with you. This webinar and others like it are just one small way in which we do that. As far as this webinar goes, please send in any questions you have as we go, but we're going to wait till the end to answer them. If you're a client and your question doesn't get answered, we'd encourage you to reach out to your SVA professional. If you're not a client and have questions, please reach out to me and I will make sure one of our subject matter experts gets those questions answered. So today we have two of the most experienced people in our healthcare and dental practice to walk you through everything. First off, we have Matt Vanderloo, who's not just a principal, but also is SVA's CEO. And we have James Emmerich, or JD, also a principal in our healthcare practice, and he works with practice owners and practice managers on efficiency and profitability strategies. All right, so without further ado, Matt, I'm going to kick it off to you.
Great, thank you, Lee. Thanks everybody for joining us today. We have a lot of great information we want to talk through today, lots of important things to think about if you're at that point where you're starting to think about an associate for your practice. Today, we're going to talk through a little bit on some of those key factors to think about when you're getting to the point where you're thinking about hiring an associate, some different options for how you might bring that associate into your practice, some different compensation options to consider, some things you want to think of and think about from the perspective of your practice and what you're doing to protect your practice with that new associate. And then a little topic here at the end we're calling slicing the pie, and we'll talk more in depth on that once we get to that point in the presentation. As Lee mentioned, we've worked with a number of dentists and a number of dental practices over the years. And one of the more frequent questions we get asked by our experienced dentists, and it's really a common question for anyone who's started a practice or has worked in a practice, has 10 plus years of experience there. And the question gets even more and more frequent as our dental clients get a little bit more experienced, i.e. a little bit older, and are getting maybe closer to the end of their career than they were to the beginning of their career. And that question is, should I have an associate in my practice? And it's a really great question to consider and to really think hard about before you do it, because bringing the right associate into your practice at the right time can really unlock a ton of potential within your practice and really take the profitability, the size of your practice to the next level. But bringing in the wrong associate or bringing in an associate at the wrong time into your practice can really have some detrimental effects and really start to set your practice back and really hold it back from where it could be going. So as we think through that question about bringing in an associate, we've got some guidelines we like to think through with our clients. And really the first guideline, the big thing there is trying to elicit from that owner what they're trying to accomplish by bringing in an associate, and what kind of help they're looking for from that associate. One of the things they might say is that I'm looking to cut back on hours. So maybe I'm looking to go from, that dentist is looking to go from 4 days a week to 3 days a week, or 4 days a week to 2 days a week in the practice, and really cut back how much they're there and how much chair time they have with patients. And bringing in an associate can be a great way to make that up. If you're going to cut back on hours, there's a lot of available clinical hours. Bringing an associate to fill those can be a great decision so that the practice stays at its current level. If you're nearing the end of your career and are looking for an exit strategy from your practice, you're looking for someone who can come in, learn about the practice, learn the patients, learn your staff, and take over that practice for you. Bringing an associate at the right time can be a great way to build that exit strategy into your practice and have somebody who's there either to be able to take over for you either in the short term or in a longer term strategy. Or if you're looking for help handling a growing patient base within a practice, the right associate at the right time can be a great way to do that. They can be that pressure relief valve that comes in and sees a vast majority of those new patients potentially that are coming into your practice, or just is an opportunity for you to divide the patient base in the practice in half and have somebody else take care of half of those patients for you. A couple factors we look at and think about when we're talking to a dentist. On the growth side, we're on a mature practice, we're looking for about $1 million of gross production. It's picking up on average 15 to 20 new patients a month and has then approximately 1,800 patients in the practice. That's the sign of a good, healthy practice. If we see those as the first indicators, that might be the first thing we're looking at to see if somebody's near that threshold to bring in that second dentist and to really get going. That means we're probably looking for consistent dental production of $90,000 per month to really be at the level we want to have a second dentist come in. And if we're going to have two dentists, we probably need to be closer to 40 to 50 new patients per month, every month, to make sure we've got the volume of new patients coming in to split between two dentists to really make sure we can maintain the practice where it is and grow it to the next level. If your growth isn't strong in the practice as is, bringing in an associate is really just going to take the existing profit and split it so that there's not the same level of profit, the same level of compensation we had before. So that's can be a downside if we don't have strong growth there. If we don't have strong growth, the associate's not going to be busy, and depending on what motivates the associate, what they're looking for, that's not going to be a great fit. So if we're slow growth, no growth, we might want to consider, instead of a full-time associate that's coming in, looking at somebody who's going to be more part-time, maybe just a day a week, maybe a day and a half a week, to help cover some of what's going on in the practice, but somebody who's not going to be there in a full-time position, really taking resources out of the practice. Some other key factors to consider as you think through this process. We want to make sure that team's involved at some level at some point, and where exactly they're involved and when exactly they're involved is going to vary based on your specific situation. But having the team on board is really going to help make that transition for the new dentist into the practice that much better. At a minimum, getting the team involved and making sure that they really understand how important they're going to be to the onboarding of that new dentist is key. So we want to have the team involved. We want to have a plan for how patients are going to get assigned and divvied up between the new dentist and our existing dentist. It might be as simple as taking the existing patient base and dividing it in half, so we're each covering it. That might be the answer. Or it might be that all of the new patients that come into the practice get referred to the new dentists. Any referrals that are coming in, unless they're specifically asking for one dentist or the other, get assigned to the new dentist so that we can get them up and going as quickly as possible and make sure they're as busy as they want to be as soon as they can be. One of the other keys we like to stress, depending on what our goal is with that new dentist, is that we also want that new dentist to feel some responsibility to grow the practice on their own. So what are they doing to generate new patients from the community? What referral sources are they working to make sure that they've got new patients coming in that are going to be their patients in the practice? And the other key, and we'll talk a little bit more about this later too, is we want to make sure that everybody understands those patient records are owned by the practice, those patients are owned by the practice, and if that associate leaves, all that information stays with the practice. Other key factors to consider, want to consider our referral and retention rates. If our existing clients, patients aren't doing a good job of referring their friends in, and if we're not doing a good job of retaining our patients, bringing an associate in is probably not, right now, isn't the best thing. How we're going to get new patients into the practice with bad referral, bad retention is going to be very expensive. It's going to be a lot of advertising to get new patients in. And that's probably just going to be too much for the practice to handle from an expense standpoint with a new associate in there. We really want to watch and be mindful of our case acceptance rates. We'd like those to be up at 80% or more. That new associate you have coming in, depending on their background, it might be a new graduate. So there's going to be a lot of coaching that needs to be in place. We're going to need the existing doctor owner to really help them and mentor them to make sure they're learning the right way to do things, the right way to present their cases, to make sure they develop that same strong acceptance rate. With that, we need strong systems within the existing practice, strong systems for communicating with patients, presenting treatment, scheduling, completing procedures. If you don't have those systems in place, it's really going to your success is going to be determined by the associate you hire and how good they are at that. If we have strong systems in place, we can help make up for any gaps that new associate might have in terms of experience in doing any of that. So really strong systems can really help make that successful. And then you're also really going to have to consider your physical space. If you're bringing in a second dentist, if we don't have enough space for that second dentist, how are we going to do that? Are we going to change the hours on the practice? Are we going to have a longer day and have one dentist work in the morning, one in the afternoon? Or how are we going to make it work so that both dentists have all the chair time they need to be as productive and as successful as they want to be? It might seem like an expansion is a great way to do that if you've got the space where you could expand, and that could make sense. Just remember that expansion can be pretty expensive. Expanding your hours is probably going to be a cheaper solution than expanding your physical space. And then the last thing to consider is compatibility. Compatibility. If you are bringing an associate who isn't aligned with your goals, your philosophies, how you want to interact with patients, how you want to interact with your staff, it's not going to be successful. You've got to have someone in that practice that you're comfortable practicing with. And that means you've got to be compatible with that person. We've got to make sure our goals are aligned with that new associate's goals. For example, if we've got a new graduate who's coming in as an associate, if they've got a lot of debt, they're probably pretty hungry, they want to produce, they want to be busy. We've got to make sure that aligns with your goals for how that associate's going to operate in your practice. All important things to discuss before you hire. So as you're starting to talk to associates, make sure you're clearly explaining what your goals are and get a clear understanding of what their goals are when they come to the practice. There are a few different ways we can think about employing that associate within the practice. We can either have them come in as just an employee, we can hire them as an independent contractor, or we can bring them right in as an owner to the practice. And there are advantages and disadvantages to each of these. If we bring somebody in as an employee, it's a fairly long commitment, but maybe not as long or as permanent a commitment as bringing them in as an owner will be. You're going to pay them like any other employee. They're going to have a base salary, or they're going to have a bonus program. They're going to be eligible for benefits if they meet all those thresholds. You're going to provide everything they need to do the work, and they're going to work at your direction. Independent contractor is a little bit different. With an independent contractor, could be a short-term relationship, could be a long-term relationship. But usually with the independent contractor, it's going to be for less time during each week, maybe just a day or two a week. Usually paid based on their production. They're not an employee, so they're not eligible for your benefits programs. But since they're just working for you on a more limited basis, maybe a little bit less loyal to your practice compared to the other two, they might be working at another practice as an independent contractor, so that could change a little bit where their loyalties are. And then if you're bringing somebody in as an owner, that's a pretty binding commitment right off the bat. There'll be a lot more you'll need to do on the front end to make sure that you understand who's coming in as an owner, and lots more documents that'll need to be drafted to make sure you understand how everybody's getting in and how everybody's going to work together. Which option is right for you is going to depend very, very much on your specific situation. What are your goals? What's the reason that you're bringing in an associate? And depending on why you're bringing them in, how big your practice is, how big your growth rate is right now, one of those different options might be a better fit for you. How close you are to retirement. If you're looking at somebody who's going to come in as your exit strategy, how soon do you need them to be that exit strategy and be ready to go for you? So it's very specific to your situation, your facts, and your circumstances, and what you're trying to accomplish. So lots of different options there about how we can employ them. James is going to talk a little bit about what that means in terms of compensation options for everybody.
Thanks, Matt. Thanks, everyone, for joining us today. As Matt kind of just alluded to, we're going to dive in. We're going to take a look at the associate compensation options. So before we dive in, we really got to think about how is the new associate going to be employed. And you can see we have three different categories or classifications. We have the employee, we have the independent contractor, and we have the owner. And Matt kind of touched on the three of them, but just kind of to run through them at a higher level. Each of these classifications is a little bit different, okay? And so when you think about it, you got to start thinking of the employee and what does that mean when you employ an associate. And first, it's going to mean usually a base pay, possibly a bonus potential. They're going to share in the benefits just like all the other employees would. So the benefit structure is available to all of them. And the most important thing to think about as you're thinking of these categories is you're going to have a contract for all three of these, and you have to get that in writing. That is probably the most important thing to stress out of this, is get your contract in writing. Compensation is going to depend on experience, and you're going to understand when you hire an employee, there's going to be some additional overhead that's going to be associated with that. The practice is going to cover lab, supplies, maybe a hygienist, an assistant, some malpractice. And then if you're offering a bonus potential, how are you going to pay that bonus? What is that going to be based off of? Usually that's allocated based on production, or you're looking at some sort of form of production, and that's exams, hygiene, x-rays. All of those items need to be factored in when you're calculating or figuring out how the employed associate is going to be paid for a bonus. Okay. It's important to note that the higher the base pay usually means that it's going to be a lower bonus potential. And the other side of the coin is true also. If you're going to give them a lower base, you're going to go with a higher bonus potential and really make it advantageous for everybody. Shifting gears over to the independent contractor, you'll see these are the three most common ways that we see an independent contractor paid. You have the hourly, you have the per diem, and then there's a formula based, usually on some sort of production. And the question really becomes then, what production are you going to use? Are you going to use gross production? Are you going to use net production? Something you and the associate or the potential candidate can talk about and determine, and you guys will set your formula based off of that. And then the last one, as Matt kind of talked about, is going to be the owner. If you're bringing in an associate to come straight into the owner side, how are they going to be paid? And that's a little bit more of a unique situation because they're skipping through the employment side. They're no longer an independent contractor. They're coming right in and they're going to be an owner. So they're going to share in the profits with you. So how are they paid? Well, usually they're going to look and see how you've been historically paid, and they're going to want something very similar. There's a base salary methodology, along with usually a profit distribution that's going to need to be done. And if you're going from one practice, one owner to a two owner practice, how are you guys going to separate and split that profit? And that's a really critical, important piece, which usually gets ironed out and discussed when the formula is being drafted. And again, it's all in the contract. The most common profit allocation method is a production-based model. Typically, it's where revenue and overhead then gets allocated based on the percentage of production produced by the owners. It's kind of the eat what you kill mentality. So the more you produce, the more revenue or profit you're going to be allocated and drops into your column. And the less you do means less for you. But again, these profit models can be very, very specific and detailed, or they can be very simple. It's really up to you and the associate or the incoming owner on how detailed you want to be as you're going through the profit model. Okay. Once you've identified how the associate is coming on board, whether it's an employee, independent contractor, or owner, you're going to need to consider how you're going to protect your practice. So thinking about the different things that you can do, you can see right on your screen, number one, you must have a contract regardless of the type of associate. And again, we cannot stress this enough. Having a contract is key. So get it in writing, make sure both parties understand the rules of engagement, so to speak, that it's been read through, the terms are agreeable or acceptable while making sure the practice is going to be protected. And remember what we said earlier, everything can be negotiated. So as you're going through this, make sure you're having open dialogue, get everybody on the same page. The last thing you want to do is run into a situation where there's a point of contention that maybe the contract is silent on. You really want to think about everything and anything that could potentially happen down the line. Okay, clearly outline all the employment terms, conditions, compensation in writing, and you're going to want to do that before the associate starts working. You can see we bolded the word before, that is critical. The contract should include the renewal term. Make sure that if there's the opportunity to renew the agreement, that's written down. Notification for termination, standard is 60 to 90 days. Make sure that's listed in that agreement. And then you want to make sure there's a termination clause that protects both you and your practice. The most important thing with having that contract and having it in writing is ultimately the practice is protected. Okay. Restricted covenants and non-competes. So the associate usually signs an agreement not to engage in dentistry within a certain distance for an agreed amount of time. It's usually different if they're an employee, an independent contractor, or an owner. And either party is usually required to provide written notice of termination of the employment agreement. These obviously differ by state and is being challenged at the federal level. Definitely need to encourage you to work with your attorney to protect your practice. The restricted covenants and non-competes are extremely common in these agreements. So if you're working with an associate and they say they don't want that in there, definitely I would encourage you not to budge on that. These are extremely common. And again, it's all about protecting your practice. You want to make sure that if the associate leaves, they're not taking your patients, they're not taking your staff or your patient records. Everything that relates to that practice is staying with the practice, and the practice is protected. Now we're going to talk about slicing the pie. And really, what does that mean? So when you're hiring an associate, obviously there's additional costs that come along with bringing that associate on. So it goes back to what Matt talked about earlier. What are your goals? If the goal is to slow down and reduce the number of hours you're in the practice, then maybe you're perfectly content taking some of that revenue and sharing it with the associate, and your compensation is going to go down. Again, it's goal oriented. If that's what you're looking for and that's what you're okay with, then go do that. If the goal is to grow the practice and expand, and you're not looking to take a haircut, then the last thing you want to do is bring on an associate who starts to eat into your compensation. And we've had practices where the goal is really to bring on an associate and grow and maintain, at least for the owner, the same level of compensation. But what ends up happening is the associate starts to cannibalize the earnings of the owner. It's an unintended consequence sometimes of hiring an associate. And so it's a dangerous thing that you got to make sure you've thought about, and you're paying attention to those metrics that Matt kind of alluded to, the number of new patients coming on. What are the goals? Can it be sustained and sustainable? Because if they're hired and they have a guaranteed salary, ultimately you're going to be on the hook for paying that dentist whether or not they're producing. So bottom line, think about what your goals are, determine what you're okay with and how you're going to split the profit. Okay. Moving ahead, and we talk about what's it going to cost really to bring an associate on board. So we threw together a quick break-even analysis. And again, this is a hypothetical break-even. It's dependent on a wide range of factors, including what the agreed upon compensation is, if they're hourly, or if they're based on days or production based. All these numbers are subject to change. But you can see here on this slide, we assumed full-time $145,000, payroll tax expense, the malpractice, the health insurance, the CPE allowance. There's the assistant that they're going to have running with them, the payroll taxes for the assistant, health insurance and benefits for the assistant. So we're talking minimum cost to start $230,000. Remember the other slide about slicing the pie? This example shows how that pie right off the bat is going to immediately become smaller to you as the owner, because the associate's going to have underlying costs that they need to build up and start to cover. Okay. So with that, we've just gone through, we've covered a ton of information. I want to thank everybody who joined us today, and I want to turn it over to Lee to ask any questions that may have come through and take us down the home stretch. Lee?
Yeah, thanks, JD. Great. You guys did a great job of getting through a lot of information in 23 minutes, which leaves us a few minutes for questions. We've had a couple come in, but please go ahead and type them into the chat box, and we can address any as they come in. I guess one of my takeaways, guys, was this is really all about what are your goals with achieving this, because there can be a lot of different reasons for doing this. When you guys work with a lot of different practices, would you say, like, where are practices having the most success in hiring people? Is it hiring an associate that's looking to be an independent contractor, or somebody who just wants to be an employee, or is it somebody who's like, no, I want to own this thing someday? Like, what do you think is the easiest for people to hire right now?
I think right now what I'm seeing is it's been easiest to hire into practices who are looking to find somebody who's going to be a long-term fit in the practice, with the eventual goal of getting to an ownership level. that it seems to be there's more people at the associate level who are looking for that kind of an opportunity where they can come in somewhere, have a long career, make a big difference in a practice, and get to the ownership level.
So just to clarify,
Matt, I've seen the same. They're really focused on the long term, trying to grow the practice and trying to be a part of something special, transitioning to ownership.
Okay, great. So that goes really well into another question we got, which was, how would you recommend an owner goes about hiring an associate if they eventually want to sell the business? I'd like to hire an associate with the idea of selling the business to them, but don't want to make that commitment until I'm 100% sure it's a good fit.
Yeah, I think most of the similar situations I've seen like that, the practice is hired in the associate, and has hired them in as an employee and hasn't made a commitment about what a potential sale might look like. So there's nothing committed, but they have been fairly open on the front end as they've talked to the associate to explain that there will be an opportunity potentially to buy into the practice, and then it usually putting some more certain date about when they're going to revisit that discussion. So it hasn't been uncommon for me to see practices bring in an associate and tell the associate that the potential exists to be an owner, but we want you to work in an associate for 2 years first. We want you to come in, learn the practice, learn the patients, learn how we do things, and get comfortable with the dentistry side. And then 2 years from now, we can talk again and see what ownership might look like, where you are on that path, when things might happen. And there's been a little variation. I've seen, instead of 2 years, I've seen 18 months, maybe once I've seen 12 months. But I think the key is communicating that the opportunity does exist. It's not on the table right now. Here's when we're going to talk about it again.
Great. Okay, we had a question come in about signing bonuses for associates. What do you guys see is common at this time?
So I'll let James chime in on this one too, because in the recent practices I've been working with, have not seen a signing bonus for associates. So I know they're out there. I know there's probably a good dollar amount that exists. It just hasn't been in my practice that anybody's been offering one recently.
Yeah, I echo what Matt just said. I haven't seen, at least for a general dentist, I have an oral surgery groups that I've seen sometimes surgeons, but in a general practice, same. I have not seen anything.
Okay. And we might have some more specifics coming up in a couple months at a webinar that I'll tell you about in a moment. But one last question we'll take, and then we're out of time. But this person says they have specific questions on how to calculate pay based on production. How do most people do that calculation?
So I've seen it's either been based off of gross or net. It's really been determined amongst the parties of how they're going to be, how the calculation is going to work, but it's production, and if it's net, then they're backing off the adjustments to get down to a net production number and saying it's that number times. If there's a threshold they have to exceed sometimes, then they got to get over a certain threshold. Otherwise, if it's just a straight, you're going to get a percentage, an incentive percentage of production. That model has been placed in service too. We can certainly help with that. If that individual wants to reach out, we can certainly help.
And I think this person asked specifically about applying adjustments based on insurance rates. So that's really the difference between your gross and your net. Is that right, JD?
Correct.
Yeah. Okay. So hopefully that answers that question. Well, good. If you have additional questions, please reach out to us. JD, Matt, as always, fantastic. As we wrap up, I just want to let everybody know you can go to svaccountants.com to sign up for the other webinars in the series. You can also find news and information that may affect your practice. So our next webinar is October 29th, and the topic is Optimize Your Practice's Retirement Plans. And make sure to get the November 14th one on your calendar while we're at it. That is where we will review the results of our annual dental salary and benefits survey. So lots of good information there. If you didn't participate, if you didn't provide your data, the only opportunity you're going to get to see that data, or at least some of that data, is by attending the webinar. So really encourage you to sign up for that. I'd like to remind everybody that the SVA team is only a phone call or an email away. So if you're a client, please reach out to your SVA professional as questions arise. If you're not currently an SVA client, contact me, Matt, or JD so we can get you the help or the answers that you need. On behalf of the SVA team, thanks for attending today. Hope to see you at our next webinars and hope you enjoy the rest of your afternoon. Bye-bye.
Thank you.